Now, a group of medical researchers say a national call centre designed to reduce pressure on emergency wards isn't working. The $220 million call centre was set up in 2006.
Associate Professor Richardson is from the Australasian College for Emergency Medicine, and he joins us now from Canberra. Good morning to you. Just why isn't this hotline working from your perspective?
Well, it's not working because there's no evidence that it's actually reducing the workload on our emergency departments. The hotline is certainly taking a lot of calls and appears to be politically popular, but the often made statement that it's reducing workload is not backed up by any evidence.
In fact, this research suggests that the workload on emergency wards around the country could in fact have increased as a result of this direct hotline.
It does, that's right. There's no doubt our emergency workloads are increasing across the board, and there's some evidence that the helplines have contributed to that.
Why would that be?
The question is about the level of risk people are willing to accept, that people who ring a helpline some people who ring a helpline may not be considering going to a doctor and are encouraged to do so by the helpline. So some people may have been going to see a doctor and have been discouraged, but the net effect appears to be negligible.
And the doctors and nurses involved in giving advice are at a distinct disadvantage, aren't they, Drew Richardson, because they can't physically see the patient and physically ascertain any symptoms. Therefore, they have to be pretty conservative.
Absolutely. This is no slight on the principle of the system. This is a reflection of the real-world results you get when you implement something like this, and it doesn't affect emergency department workloads.
And how much strain is it putting on emergency department workers?
Well, emergency department workloads are going up by about twice the population growth every year at the moment, and the contribution from help lines to that is pretty small no matter which way you measure it. But there's no question our emergency departments are under pressure just in terms of the increasing illness and increasing ageing of the community.
Or how, in your view, would the $200 million the government is spending on this hotline be better spent in hospitals and in particular in emergency wards?
It'd be better spent on providing services to get patients out of emergency departments who no longer need to be there, those who require admission. It'd be more economically spent in many aspects of the health system. The Rural Doctors Association calculated that the help centres are costing around $1,000 for each patient that they advise not to go to the emergency department. 20,000 patients that were so advised represents 0.6% of the emergency department workload. It's just trivial. We'd be much better off getting our inpatients out of EDs and getting flow through the hospital system to make sure that the sickest and most vulnerable are cared for.
OK, Drew Richardson in Canberra, thank you very much for your time this morning.
Thank you.